UMass Amherst will soon have abortion medication available at its health center. Western Mass News reporter Kristen Burnell has the details.
I think it's a problem that we've discussed and almost, I think for the most part, generally solved, where abortion, we saw in Roe v. Wade, it was acceptable across the country.
UMass Amherst students reacting to the recent announcement that starting in the fall, abortion medication will be offered at the university's health center.
Really excited to see UMass Amherst taking the lead on this issue. It has been a long conversation.
State Representative Lindsay Sabadosa has been campaigning for a bill that could increase access to abortion services at public universities, such as UMass Amherst across the state.
If we are going to be a state that says abortion is healthcare, this makes a lot of sense to allow students to get healthcare where they seek out healthcare, which is on campus. Really, I think the point that I do want to get across is, this is happening on campuses already. We're just trying to make sure that it's done safely and that students are supported.
UMass Amherst's decision marks a major victory for Representative Sabadosa, who tells Western Mass News that students at the university have limited access to abortion clinics such as Planned Parenthood. Abortion medication can be taken to end a pregnancy up to 10 weeks and involves a two-step series of pills. Sabadosa emphasizes that it is safe to take the pills at university campus clinics where many college students reside.
They've tested for many years, first in Europe, and then it has about a 20-year history in the United States as well. We have conducted research that, this would help about 1,000 students a year. That's in line with the number of students who seek abortion.
The director of communications at UMass Amherst tells Western Mass News in part, quote, "The UMass Amherst campus has a long-standing commitment to providing quality, respectful, and confidential gynecological and reproductive health services. Currently, a UMass Amherst student seeking a medical abortion pill is referred by our on-campus health clinic to a regional hospital or an affiliated provider. We offer students transportation to and from the appointment to the medical provider, as we do for any student seeking a procedure not offered by the university." University officials tell Western Mass News that students were a driving force in making the medication more easily accessible.
This legislation was brought to me by students before I was even elected. We're just trying to make sure that students can then get the follow-up care and have the conversation with a healthcare professional that they trust and know right there where they live.
If it is healthcare, it should be accessible, so making it easier for students to be able to access healthcare services is always a good thing in my opinion.
Reporting in Amherst, Kristen Burnell, Western Mass News.